to this video demonstration and the proper donning and doffing of personal protective equipment. Proper donning and doffing of a PPE is one of the basic steps in a safety culture because it protects its users against any physical harm or hazards that the workplace environment may be present. It is important because it exists as a preventative measures for industries that are known to be more hazardous. So that's why healthcare professionals must be educated in a proper application of a PPE removal in order to protect themselves and their patients. Correct PPE use is crucial to infection control and prevention, and you must always ensure correct procedures for donning and doffing are followed. In this video, you will be guided on how to properly don and doff the PPE. It contains the equipments, the donning sequence, and the doffing sequence. So let's begin. The very first step in this process is to make sure that all the equipment is available. And this is the equipment that we need. You have to make sure that hand sanitizer or hand rub is available. Impermeable or fluid resistant isolation gown. This isolation gown will serve as our outer gown. We also need to secure the coverall suit, which will serve as our inner gown. Make sure to select the appropriate type and size. Do not also forget the 3 pairs of nitrile gloves with extended cuff. Why 3 pairs of nitrile gloves? So the first glove, that is the inner glove, the second glove is the outer gloves, and the third gloves that are used during the patient care. Remember, the third glove must be changed in between patients with the obvious signs of tears, holes, or contamination. Your N95 filter mask, your full face shield in which you can be worn with safety glasses, but remember, not with goggles. Your surgical mask, which can be worn over the N95 filter mask. The bonnet. You can also secure your shoe or boot cover. As well, for your eye protection, you can use goggles and safety glasses. Remember, if goggles, it should not be worn with full face shield, but if you are going to utilize the glasses, this can be worn with full face shield. So those are the equipments that you need for donning of PPE. Now, let's proceed to the proper sequence of the donning the PPE. First, you need to remove all the jewelries, watches, wallets, and other personal items. Eyeglasses can be worn if needed. Tuck pants legs into socks or boots. Use a bonnet to cover your hair and ears. For long hair, wrap a hair tie around your hair and perform a hand hygiene. You can use soap and running water. Apply your N95 filter mask. Remember that in the application of this N95 filter mask, it should be a snug fit. So this is how you're going to properly do your N95 filter mask. Adjust and ensure a proper tight fit with no leaks. Have your surgical mask worn over your N95 filter mask. Next, don your shoe or boot cover and perform your hand hygiene. You can use 70% ethyl alcohol, scrub your hands, and allow to dry for at least 30 seconds. Next, you need to don your first gloves, which is your inner gloves. Adjust for comfort as well as the dexterity. Next is the coverall suit, which will serve as an inner gown. You fasten at the waist, and in this case, the body, which is another healthcare professional, can assist with this if needed. Apply the second glove, which is the outer glove. You tuck the glove of the inner gown securely under each glove. Next is your impermeable or fluid isolation gown. The body can assist with this if needed. And don the third gloves. Tuck the gloves of the outer gown securely under each glove. Then, you can use either the goggles or the full face shield. In this time, the body, which is another healthcare professional, do the visual inspection of the PPE. Once it is on, use PPE carefully to avoid contamination. Follow the general safety purposes. First, keep hands away from things. Limit the surfaces that you are going to touch. And change the PPE when torn or heavily contaminated. And that is on how to properly don your PPE. Now, let's proceed to proper doffing of PPE. The healthcare worker will inspect the PPE for obvious signs of contamination. If so, wipe with alcohol wipes or disinfect with alcohol-based hand glove. The very first step in doffing your PPE, that is to disinfect the third glove with the APHR and remove the third glove. Remember, do not snap the glove, which can cause scrape, and follow the glove-to-glove techniques. Inspect the inner gloves for clear holes or contamination. If there is none, disinfect the second glove with APHR and wait for 30 seconds. Remove the face shield or goggles. You have to bend forward, gasped for removing the back by lifting the headbands slowly to avoid snapping without touching the front of the goggles or face shield. Disinfect the second gloves. And then you have to remove the outer gown. The body can assist with this. You gasp gown at the back part, pull away the gown by touching inside the gown only, and turn gown inside out and away from the body and dispose. Disinfect the second gloves, remove teeth, and as well as dispose. And disinfect the first gloves. Remove now the coverall suit, which is the inner gown. In this case, the body can assist with the removal of the coverall suit. Disinfect the first glove and then remove the shoe or boot cover. Be careful not to touch one like the other. Disinfect again the first glove. Disinfect the shoes using alcohol wipes from top to bottom, including the sole. And then disinfect the first glove, remove and dispose. And then perform a hand hygiene. And this time, let the healthcare professional re-inspect your body for contamination. Now, let's remove the N95 mask and bonnet. So first things first, you need to disinfect your hands using ABHR and allow them to dry for 30 seconds. Wear clean gloves and of course, remove first the surgical mask. If earlobe mask, you need to tilt your head forward using both hands to grab and remove the strap of both ears. Disinfect the gloves and remove the N95 filter mask. In removing the N95 filter mask, you have to tilt your head forward and use your two hands to grab the bottom strap. And next, use both hands to grab the upper strap and dispose. Disinfect the gloves, remove the bonnet, grab the back of your head. Disinfect the gloves again, remove it, then dispose of it. And of course, disinfect your hands using ABHR, wear your face mask, and you're ready to go. And that is how we are going to properly take off the PPE. Thank you and have a great day.